I think this week's probably going to be pretty critical to determine whether, kind of what we see with him. You take 3 weeks off and you're 38, and then you have to get back and be impactful on the court. So I think this week is really the critical week to see, are we going to see Curry play meaningful minutes at the end of the season, or is this going to be something that's going to linger on and the team decides, hey, this is in the best interest of him playing for the rest of the season so he doesn't have something that becomes more serious or leads to a secondary injury somewhere.
At Dr. Niranjan Pandya, professor of UCSF Orthopedic Surgery, director of pediatric sports medicine. And I love how he puts this on his Twitter profile. Tweets equal opinions, not medical advice, people. All right? But the guy knows what he's talking about. And we want to talk about runner's knee. Doc, first and foremost, have you ever dealt with runner's knee personally? And good morning. Morning, Doc.
Hey, good morning. Hi, guys. Thanks for having me on. Yeah, absolutely. So I ran track in college. I tried to compete post-collegiately. And I dealt the first year afterwards, dealt with it the whole year. I mean, it's a painful, annoying thing to deal with. And the tough thing is you sprain your ankle, you pull your muscle, you kind of notice yourself getting better. With this, you can be feeling great. You go back out and try to do a workout and run, and then it comes right back. So it's a frustrating thing. It's this dull, achy pain. And for an athlete like Curry, who's running all the time and doing explosive stuff, it's not surprising that this would develop later in his career.
What was the most alarming or concerning aspect of the latest report where they said that he hasn't even done anything on the court yet and he's going to be reevaluated in 10 days?
I think it's that part of it. It's the lack of progression. Sometimes when you see, athletes will be like, look, this is bothering me a little bit, but I was able to work out and I just needed like a week or two. The fact that he hasn't been, doing stuff on the court. And I think there was a quote where he said, I'm having trouble even sitting down, because it kind of gives me some discomfort. I think the combination of those two things are concerning. And on the MRI, when they got that repeat MRI, they said there was some bone bruising as well. So I think the combination of those things makes it seem that, this might be a little bit more serious and might take a little bit longer to turn around, which is tough because we're at the latter end of the season where we need him to kind of win those games and move up in the playoff rankings.
So if he hasn't done any on-court activities as of now, what would we be looking for over the next 10 days? And obviously, you have to see the knee. You have to see the athlete. I understand we're asking you blindly to make a suggestion here, but do we see him in 2 weeks, 3 weeks? Just your feel for this.
Yeah, I think this week's probably going to be pretty critical to determine whether, kind of what we see with him. I mean, I think if we do see him back on the court, we see him doing some shooting and we see him progressing, I think that's a positive sign. If we see another week where he's not doing anything, then the other thing you have to think about is how quickly can you ramp back up and be in shape to play basketball? That's the other thing, right? You take 3 weeks off and you're 38, and then you have to get back and be impactful on the court. So I think this week is really the critical week to see, are we going to see Curry play meaningful minutes at the end of the season, or is this going to be something that's going to linger on and the team decides, hey, this is in the best interest of him playing for the rest of the season so he doesn't have something that becomes more serious or leads to a secondary injury somewhere.
Doc, obviously, the big story is Steph Curry, but another big story right now is Kristaps Porzingis, and they're calling it a general illness. And, we were told, or at least the fan base was, that heading into, this whole trade deadline and when they acquired Kristaps, that he has been dealing with something that we all thought was called POTS syndrome, if you will. And I'm not going to try to butcher the actual name, but I'll try. Maybe you could correct me. Postural orthostatic tachycardia syndrome. We don't know if that's what it is. Steve Kerr was asked about that with Willard and Dibbs on Friday. He talked to the Atlanta GM, he said. The Atlanta GM said it wasn't it, and then he backtracked on Saturday. Just what is POTS, and what is something that, maybe the average person doesn't understand when it comes to that?
Yeah. So, in general, what POTS actually is, I mean, take a basic thing that we all do. When we get up and stand up, most of us stand up, we're fine. We don't get dizzy. We don't get lightheaded. What happens in POTS is that, your nervous system, the controls kind of okay, we're going to get your blood back up to your head when you stand up. It just doesn't work. And then as a result, you get heart rate issues, you get fatigued, you get tired, and it's kind of something you're dealing with all the time. And I think whether this is POTS or it's something else, clearly he's dealing with something that's been described by various people, something that leads to these kind of symptoms. And the tough thing with POTS is that, we can diagnose that, we can diagnose some other condition, but he's dealing with something that prevents from being on the basketball court. And it's something that isn't necessarily you can push through. It's not something where it's there's a lack of effort there. I think clearly this is a guy who's played in the NBA for a while, wants to play, and has been dealing with something that manages his nervous system, and it's not working very well. So I think it's less about the diagnosis and more about the fact that, hey, this guy has a condition that suddenly he can be playing one night on a Thursday and then he's out for 5 days. And it's to the point where people are describing it as a severe illness. So once again, I think it's just the conditions affecting the things that you can't train, you can't control, you can't push through. And I think that's the important thing we all have to understand as fans.
So, what was interesting to me is just more like big picture. Like, what's fair game, And I was thinking about this, my family, I want things to stay private, and I wouldn't want my doctor or anyone disclosing private stuff. But when you are in a public job and people are gambling on things and, whether this were a board of supervisor, a mayor, a governor, there is a level of transparency that I think the public requires depending on the employment status. Do you get where I'm going with this? I guess, what is your point of view regarding what's fair game and what's not, regarding certain individuals being asked questions about availability and what's really going on, specifically when it comes to sports?
Yeah, no, that's a great question, Joe. I think that with, particularly with Porzingis, I think it's hard to, you get 20 doctors in a room, they're going to disagree on what exactly his diagnosis is, right? Maybe the Boston doctors are different than the Warriors doctors and the Hawks doctors. But I think in general, for players as well, too, I think it's totally reasonable to describe what is a player actually going through, what are the symptoms? I think that's reasonable. I don't think that necessarily gives you a competitive advantage, but it's hard. And I think a lot of this may simply be the fact that he's ill and they don't exactly know what's causing it, right? And maybe you could say what he's going through, but maybe he's like, look, I just don't feel good, right? And I think that there's also the protecting the player as well, too, because, you understand the fan base. If they're like, oh, he doesn't feel good, well, why can't he just push through it? So I think sometimes it is kind of this delicate balance of how do you, say what we know about the condition. Maybe there's some uncertainty. And then what do you describe about the symptoms they're experiencing? And maybe it's changing day to day. But I agree. That is a fan base. You're a public person. There's a different degree of privacy that a public figure has than someone who is, just a regular patient that we see in clinic.
Well, and the thing that I always think about, they're all in bed with all these gambling companies, and you have long-term and short-term futures bets, and you have tonight's, different winners and stuff. And I just wonder how, I guess what should the standard operating procedure be for us on the journalism side or the media side versus the team disclosure side? What's fair game and what's not? I just think that the lines are so blurred, and I don't know, everybody, so-and-so's violating the law. And it's all right, well, I get it for the average person, but this is a unique situation. So that's why I wanted your perspective on it.
Yeah, absolutely. I think where this really needs to go is as the NBA starts doing this more and more and has these relationships with these companies and these websites, and they have to make the strict rules or give guidance in terms of what needs to be disclosed, what can't be disclosed. I mean, I think the very fact that we even have an injury report, right? That's already a certain degree of kind of different, we don't tell what you guys are dealing with, oh, Joe's got a sprained ankle. It's on the 95-7 the game injury report, it's not coming out. So I think that's something that the NBA really has to give strict guidelines for. And if they're going to go all in on this, then they have to be more transparent with people. If they're not, then they need to protect the players. So I agree. It has to come from the NBA in terms of how they're managing it, and the team physicians everyone have to come together. But I agree. It's hard because the more and more you do that, the more information people want and the less specific the teams are getting.
Doc, first and foremost, I know you're a fan above being a doctor. You're a Warriors fan. You're a Bay Area fan. I mean, you got to see what Jonathan Kuminga is doing in Atlanta, right? Just come on. How you feeling about that? Is the JK Hawks jersey in the cart yet?
I'm not going to talk about that publicly, but I'm talking about disclosure. No, but I think that, we both, Joe, I know you coach as well too. You can get a certain player in a certain environment and they can do wonderful, and you take them to another team and they don't. And that's not a reflection on the player. It's not a reflection on the coaching staff. Atlanta's the best fit for him, right? And I think that if you take a player like Kuminga, if you put him in an offense with Steph Curry, it's different, right? Kuminga's doing great because he's in a different environment. And I think it's great for him. It's great for his career. And I think that a lot of people in the fan base are like, oh, the Warriors screwed up, things like that. No, it just wasn't the right situation for Kuminga. I'm sure Jordan Poole did phenomenal here, right? And then he goes somewhere else and he's not doing well. You have to take the right situation, the right player, and it's working out for Kuminga, and hopefully it sustains his career. But yeah, no, I think it just wasn't the right fit over here. But it's glad to see now seeing him doing well, obviously, as we're struggling a little bit.
I know it was a tough one. So, all right, Steph Curry, just a couple questions on him because, you talk about the ramp up period and what does that look like to you? I mean, just obviously from your perspective, what does that look like? And is there a date on the calendar? You got about 21 games left. Is there a date on the calendar where you just kind of wave the white flag on this year if you're part of that medical staff? for Steph?
Yeah, I think in general what you're doing, you're looking for on-court work and then the usual progression. You're like, individual work, 3-on-3, 5-on-5. I mean, I think if within 2 weeks you're not doing 5-on-5 consistently, then that number one, that indicates that inflammation is pretty severe. Number two, are you then placing him at risk for, injuring something else? And then number three is, can he actually be impactful on the court? And I think that's the hardest thing. This is one of those things that if Steph Curry can't be Steph Curry, what's the utility of having him out there? And if he leads to something that's a little bit more serious, particularly that he's going to be turning 38 this month and he's not, 24. So you have to be very cautious. So I agree that if this doesn't really turn around in the next 2-3 weeks, then that's the point at which you've got 5 games left. What's the utility, particularly if you're looking at where the team is at that point?
Any worry that this might linger into the offseason or next year? Or is this something that can come and go? Or like, how should we be viewing this long term, I guess?
Yeah, I think as long as you're disclosing exactly what's on the MRI and there's not some sort of like cartilage damage or meniscus thing that they're not, saying that's there, then absolutely, I think this will get better in the offseason. It's from overuse. It's from doing a lot. This started to creep up right when Jimmy Butler got injured. So not surprising that goes with increased workload. So I think that he's got a good offseason to relax and recover. I think this shouldn't be something that lingers into next year.